morning everyone. My topic for today's presentation is comparison of amplitude of accommodation determined subjectively and objectively among university students. Ethical clearance was obtained from relevant ethics committee before commencement of the study. There are no financial obligations associated with this research. Accommodation is the ability of eye to focus on objects at close distance. Accommodative amplitude is the amount of accommodation exerted to move focus from the far to near point. The subjective methods used in this study are push-up, pull-away, minus lens methods, and objective methods used in this study are dynamic retinoscopy and Pascal heterodynamic retinoscopy. The objectives of the study is to compare the difference in amplitude of accommodation using subjective and objective techniques in patients with different refractive errors, to compare the values of amplitude of accommodation obtained from subjective and objective techniques. It's a cross-sectional observational study. Study population is 60 university students between the age group of 18 to 30 years who met the eligibility criteria and consent were taken. The eligibility criteria is emmetropes, myopes with early onset minus 0.5 diopters to minus 10 diopters, 13 years or earlier. Late onset minus 0.5 diopters to minus 3 diopters, 15 years or later. Hyperopes, an age group between 18 years to 30 years, and subjects having visual acuity 0 log units in each eye. All the history was taken, visual acuity measurement was done. Orthoptic evaluation like cover uncover test for near and far distance is done. Slit lamp examination, indirect ophthalmoscopy was done. Near point accommodation using RAF ruler with an average of 3 readings were taken. Amplitude of accommodation for the subjective methods like push-up, pull-away, minus lens methods, and objective methods like dynamic retinoscopy, Pascal heterodynamic retinoscopy was done. Statistical analysis was done using ANOVA to compare amplitude of accommodation in objective and subjective techniques with emmetropes, myopes, and hypermetropes. Pearson correlation was used to find relation between each objective and subjective strength of correlation analyzed using Evans guidelines. This table shows the mean values in emmetropes in different methods like push-up, pull-away, minus lenses, dynamic retinoscopy, and Pascal heterodynamic retinoscopy. All these values were significant. And this table shows the myopes. Even this table shows it is significant. These are the values in hypermetropes. So this is a bar graph showing the mean amplitude of accommodation of dynamic retinoscopy in both the right eye and left eye for emmetropes, myopes, and hypermetropes. This shows that myopes has higher mean values compared to, then comes the emmetropes and hypermetropes for dynamic retinoscopy. And the second one shows for Pascal heterodynamic retinoscopy. This also shows myopes are having the higher mean values than emmetropes and hypermetropes. This bar graph shows push-up technique, which also shows myopes having higher mean values than emmetropes and hypermetropes. So this shows the pull-away technique, where myopes are higher than emmetropes and hypermetropes. And the second one shows for the minus lens technique, where the myopes again are showing the higher values than emmetropes and hypermetropes. So in our study, the push-up technique produced the highest amplitude of accommodation, significantly exceeding other methods, similar to Chiranjeev Majumdar et al. Study. The present study showed a significant difference in amplitude of accommodation among emmetropes, myopes, and hypermetropes when using push-up, then pull-away, then minus lens, and the dynamic retinoscopy and the Pascal heterodynamic retinoscopy. Our study showed a higher amplitude of accommodation in myopes, followed by emmetropes and hypermetropes, which is similar to Chiranjit Bal et al. Study. So to conclude, this study concludes that mean amplitude of accommodation obtained using push-up technique was higher when compared to all the other techniques, and the amplitude of accommodation was higher in myopes than emmetropes and hypermetropes. These are my references. Thank you.
Thank you, Dr. Sai. I think your conclusion would have been much better supported if you had carried out a post hoc analysis after the ANOVA. So the conclusion is based on a visual examination rather than a statistical analysis there. Yes, you have one group is distinctly different from the other groups, but which is the distinctly different group would require a post hoc analysis in this one. And your observation, sir?
Yes, like the minus lens technique, you said that both have unequivocal results, right?
Yes, so the minus lens technique is when we ask the
So
patient
it
for
was like unequivocal for both hypermetropes, myopes. I think it did not vary.
yes, sir.
Okay, so I think as sir said, apart from the ANOVA, you could have just compared and come out with a conclusion which one to go ahead with, like for unequivocal results maybe, right?
It's a good study. You see, it requires a little bit more analysis. Again, correlation was not the best parameter to use because correlation will be affected by the extreme values. The end points are going to affect the value of the correlation. So probably there are other measures which have, because there is a lot of work going on in the center, which is not picked up by correlation as being used as a measure. But definitely interesting, you need to work more on this.